Pain near the shoulder blade is actually a very common presentation, and in a lot of these cases, the cause is often thought to be just a muscular trigger point or a knot that just needs to be released. But in most of these cases, that is actually not the correct diagnosis, and the treatment then often only provides short-term relief, if any at all. I can tell you there are actually two very common but often misdiagnosed reasons why people experience pain near the shoulder blade, and in this short video, I'm going to tell you about both of them. Pain that you feel near the shoulder blade, particularly just on the inside of it towards the spine or just above it towards the neck, is often not just a simple muscle problem like a trigger point. Now, a trigger point certainly can cause pain, but with the majority of these cases, it's often not the primary issue, especially when it's been very, very chronic. When we go over this case and do a detailed history and a detailed assessment, we often find that the underlying diagnosis has actually been missed up until that point. So if it's not just a trigger point that's causing the pain, then what is actually going on? Well, number one, this pain that you might be feeling is often referred pain from the neck. In a lot of these cases, it's an inflamed disc or a joint which is causing the pain that you feel down by the shoulder blade. This type of pain usually feels deep and achy when it's at a low level, but it can also get really bad sometimes, and then it becomes very sharp, very stabbing, and some patients even report that that pain can feel like someone is jamming a red hot poker in by their shoulder blade. If this pain that you're feeling is actually referred down from the neck, it'll often be better or worse with certain positions and certain movements. So for instance, it could be turning your head and looking over your shoulder, or looking up and down all the way. Those sorts of changes in movement can make the pain feel better or worse. And where you feel the pain is not random. There are actually really well-defined patterns which are called sclerotomes, and these map through to certain segments of the neck. So clinically, we can actually figure out where this pain is coming from. The other reason for chronic pain near the shoulder blade is something called a peripheral nerve entrapment, and there are two nerves that are frequently involved in this. One is called the accessory nerve, or the spinal accessory nerve, and the other is called the dorsal scapular nerve. Now, a nerve entrapment is when a nerve outside of the spine becomes stuck to the surrounding tissues and it can no longer slide, glide, and move like it's meant to. This is actually a very common problem, and you can get a whole range of different symptoms when this happens. Chronic tightness, tension, a feeling like you can't sit your shoulders down, aching pain, or just a feeling of having a knot that just doesn't go away. These are symptoms that are all synonymous with a nerve entrapment, and until that entrapment is actually diagnosed and treated effectively, most treatments are going to provide only short-term relief. So there's no doubt that trigger points can cause pain, but we do need to zoom out and then consider what is more likely to be the underlying cause, especially in these cases where the problem just keeps on coming back. It is really important to get a full and detailed clinical assessment, because you need to be able to at least rule out if the pain is being referred down from the neck, or if there's a nerve entrapment involved, or possibly even both. I hope this video has been helpful, and I want to thank you for watching.